Now I welcome to this workshop to all of you. Thanks for joining the workshop on One Health Security, Safeguarding Against Emerging and Re-emerging Veterinary and Zoonotic Diseases in Africa. I know for those who have joined now, it will be a repetition, who have been already listened to me about the introduction. This workshop is organized, as you see on the top of my head, by three organizations: the Global Alliance for Pandemic Preparedness and Response, we call it as APAR, along with the partnership with International Livestock Research Institute, ILRI under the CGIAR, and African Union for Development Agency. At the outset, I thank you all again. I am Dr. Rao, the Vice President of Sri Balaji Vidyapith University in the Coromandel coast of India. The place is called Puducherry or Pondicherry. Very nice tourist place. At the outset, I thank you again for making it convenient to attend the workshop. As I see from the agenda that we have 5 different time zones. And now before we start, I would like to introduce what is APAR. We are been having a lot of workshops in India in collaboration with Penn State and Johns Hopkins since 2017. As a result, we had launched many networks on brucellosis, anthrax, even with the support of DETRA recently, and also bovine tuberculosis. During the implementation of this and talking to many stakeholders, we thought that it is high time to take stock of entire zoonotic infections and One Health scenario. And we made a One Health conference in 2019 in January, New Delhi, where 28 countries participated in collaboration with Penn State. There were a lot of participation from the intersectoral partners from different ministries. We found that 3-day deliberations resulted in lots of information. Finally, we ended up in a declaration which will be available on your website, from our website, that is aparweb.org. Now it will be put on the chat box after some time. You can download and see what is this declaration is. One of the recommendations of these deliberations was to create a platform or agency to share this communication and spread the message of One Health in the proper perspective. Yesterday, I was very happy to see that you can see the 2019 declaration from the One Health conference. As a result, some global leaders, along with co-founders, came together in 2020 to review these declaration, and then thought of developing an alliance, which is called Global Alliance for Pandemic Preparedness, almost around the type of onset of COVID-19. The sole purpose of this alliance is to have a South-South cooperation, also aligning with the knowledge and technology from northern region of the hemisphere, so that we have a triangular, seamless, sustainable partnership to face endemics, outbreaks, and epidemics and pandemics, particularly driven by zoonotic origin. APAR hosted nearly 4-hour virtual planning workshop on February 25th, 2021, which was attended by experts from across 13 time zones. And Dr. Dieter played a very important role from ILRI. The workshop was truly global, with balanced presence of subject experts, thought leaders, policy leaders, partners across the global South and North. The workshop included representation from UN organizations, WHO, OIE, and many other partners. Now, one of the recommendations of this workshop was, besides many countries like Southeast Asia and others were also joined, but one of the recommendations, very important to cut the story short, is that we should have a regional dialogue to deep dive into the problems and then understand what is actually bottom-up issues that can be taken up for future actions. Many of these conferences and workshops lead into a lot of recommendations, but this time we should use this forum to develop actions, programs, and plans so that they are helpful for the region, as also as an example for South-South cooperation, the purpose of the APAR. Now, in this workshop, we are glad to again say As a result, for the understanding African issues, we collaborated with Ilri, and Dr. Dieter and Dr. Ekta and his team has really been with us for almost 8 months, munching on this agenda. And it was a great journey that we have come and reached the second day of this workshop. And the summary of the first day is very important. A lot of issues were discussed. I can't just go on narrating them. We have put the summary of the text on the chat box, which was summarized by one of our co-founder, Dr. Kai, yesterday. And you can download and have leisurely. Now you can read, or in the site when discussion is going on, you can relate your discussions around the first day summary. And the summary is already on the download in the chat box.